We are on live and we are taking the session, ma'am.
Yes, sir.
Yeah. So very good evening, doctors. I am Dr. Stalin on behalf of Shield Healthcare, welcoming you all for the today's webinar. The topic for today's webinar is myths and fact on PCOS. I welcome all the participants. I request them to post their queries in the chat box, if any, so that we can have a short Q&A session at the end of this presentation. And now it's time to introduce our topic for today's webinar is myth. Invited speaker for the day, Dr. S. Malini ma'am. Madam has done her MBBS, MS and DLS. Madam is graduated from Madurai Medical College and Madam has done her post-graduation from Salem Medical College. Madam is currently associated with ARC International Fertility and Research Center as consultant fertility specialist. Madam was also associated with Bharat Mission Hospital and Kavin Hospital as consultant obstetrician and gynecologist. Madam is interested in academics and Madam has won the first prize for paper presentation at Oxycon 2014. And Madam has also published various research articles in national and international journals. So with this short introduction, I welcome you, ma'am. I'm handing section to you for your presentation, ma'am. Welcome, ma'am.
Thank you for the kind introduction, sir. I welcome everyone for the most interesting webinar on the most demanding topic, PCOS. Since the incidence of PCOS is increasing, the myths about PCOS is also increasing. So today being April 7, World Health Day, I'm here to break the myths on PCOS. Whenever we take up a webinar on PCOS, we always discuss about the pathophysiologies, the diagnostic criteria, LH, FSH ratios, and myoinositol and whatnot. Even though we are very strong enough on the theoretical part of PCOS, we struggle a little in our day-to-day OPDs to answer very common doubts of the OP patients. If at all we consider a scenario of an adolescent PCOS where her anxious mother will be asking us, "Madam, you told me my daughter has got a cyst." And she will be asking us, "How big is the cyst, ma'am? And will it cause pain for my daughter? Should she get operated for it?" And if we say no, she will ask us, "If I take all these pills prescribed by you, will my daughter be cured of the PCOS immediately?" Then we will be stuck there. If at all, if it is going to be a case of infertile women, and if you tell her that she has got PCOS, she'll be asking us, "Madam, won't I get pregnant with my PCOS?" If I say that you can get pregnant, her next question will be, "Ma'am, will I get pregnant as soon as I take all the pills prescribed by you, ma'am?" Oh my God, the questions will be continuous in our OPDs and it will be little difficult to counsel the patient. So now I'll begin breaking the myths one by one. Coming to the introduction of PCOS, as we know, it is a heterogeneous endocrine metabolic disorder characterized by hyperandrogenemia, chronic anovulation, and or polycystic ovaries on ultrasound. This hyperandrogenemia will cause acne, hirsutism, and hyperpigmentation. And this chronic anovulation is the important cause for infertility. This polycystic ovarian syndrome is becoming a very common condition and it is affecting 1 in 10 women of reproductive age group. While the PCOS can happen at any age after puberty, it is being commonly diagnosed in their 20s to 30s when a woman is struggling to get pregnant and when she gets her first ultrasound done by a gynecologist. Like many other conditions, there are a lot of misinformation surrounding the PCOS in the movies, TVs, and online. Coming to myth number 1, if you have PCOS, do you have polycystic ovaries? No, it is not so. Many women will have cyst, but they will not have PCOS. But many women will have PCOS and they will not have cyst. So in general, the symptoms of PCOS will include irregular periods or no periods and high testosterone levels resulting in extra hair growth on face or body and acne and thinning of hair on their head. And there will be weight gain, which will be very difficult to lose. Coming to myth number 2, PCOS only affects overweight women. No, it is not so. PCOS can also affect healthy and women with low BMI. But when a woman with low BMI goes for a diagnosis, she will be misdiagnosed mostly, and rarely she will be diagnosed as PCOS. But if at all an overweight woman goes for an ultrasound, for a counseling, she will be diagnosed as PCOS most often. Coming to myth number 3, will losing weight get rid of PCOS? Losing weight will not get rid of PCOS, of course, but it can help in lowering the blood sugar levels, and it can improve how your body is using your insulin, and it will help to regulate your hormones. And even 10% loss in the body weight can improve the insulin sensitivity and the ovulation. Myth number 4, you can't get pregnant if you have PCOS. Is it so? No. As a fertility specialist, a big no for this. PCOS is one of the most common and treatable infertility causes in women. PCOS will interfere with ovulation, thus making getting pregnant little difficult. But by working with a fertility specialist, of course, you can get pregnant either naturally or after fertility treatments. Myth number 5, you did something to cause it. Whenever an adolescent girl is diagnosed with PCOS, her mother will be telling her, you have done something and that's why you have got the PCOS. And it's not so. While the exact cause of PCOS is unknown, one thing is certain, and you are not to be blamed. There are several factors, including genetics, that play a role. And the next myth is, if you have your menstrual cycles being irregular, you have PCOS. It is not so, because irregular periods can be caused by many reasons, like breastfeeding, extreme dieting or over-exercising, pelvic inflammatory disease, or uterine fibroids or thyroid disorders. But the normal cycle is 21 to 35 days. If at all your cycle is less than 22 days or more than 34 days, you have to talk to your gynecologist. Myth number 7, insulin resistance in PCOS causes weight gain. An absolute no for this. Everybody think that insulin resistance is causing weight gain, but the vice versa is true. Many people say that because of insulin resistance, there is weight gain, but the weight gain is causing the insulin resistance everywhere. Myth number 8, every woman with PCOS should go on for birth control pills. It is not so. Doctors can prescribe you hormonal pills for your cycle regulation, but hormonal pills, oral contraceptive pills, are not always required for all the PCOS patients. So your treatment will depend upon your goal. If at all your goal is going to be cycle regulation in an unmarried girl, the treatment will be different. And if at all your goal is going to be a pregnancy in a married woman, then your treatment will be of a different track. Coming to myth number 9, all women with PCOS have unwanted hair growth and acne. It is not so. The presentation can be different in different women. So all women will not experience unwanted hair growth and acne. Myth number 10, ovarian cyst will require surgery. No. And I say there is a big no for this. With PCOS, the cysts are not large, so they will not cause pain for you. So surgery is not required. And what we mention as cyst is actually the follicles which are fluid filled, and they appear like cyst on the ultrasound. Myth number 11, pain is a symptom of PCOS. No, people with PCOS will not have pain, and only large ovarian cysts can cause pain, and it will require surgery. And ovary in a woman with PCOS will have many tiny cysts which will not be painful. Myth number 12, single symptom will indicate that you have PCOS. No, PCOS is a group of symptoms, and it is a syndrome actually, where just one sign or symptom is not enough for the diagnosis. Myth number 13, women with PCOS need not use contraception. It is not so. Women with PCOS will have difficulty in ovulation, but it is not that they do not require contraception. So women with PCOS will also require contraception if they are planning for if they are planning to delay their pregnancy. And myth number 14, all women with PCOS are at risk of metabolic complications. It is not that all are at risk. It depends upon the severity and where the patient can develop insulin resistance, where the body does not respond properly to the hormone insulin, and they may develop type 2 diabetes or metabolic syndrome. This metabolic syndrome is the collection of factors such as high blood pressure and poor cholesterol levels. Consequently, some women with PCOS also report anxiety about their long-term health. However, the potential consequences are not the same for all the women diagnosed with PCOS. Myth number 15, PCOS is self-diagnosable. No, PCOS is always not self-diagnosable. If at all you think that you can treat your weight gain, mood swings, acne all by yourself, it might be difficult to treat all the complications that we have discussed above. So apart from following the above, you may need to consult a specialist and notify your progress. And if at all you see any major changes, you have to report to your gynecologist. Myth number 16, PCOS is a rare condition and affects only a few. No, it is not so. PCOS has become very common nowadays, and 20% of the women in India of the right childbearing age have PCOS. So PCOS is a syndrome that has become quite common in women with hormonal endocrinological disorders. While only less than half of the women with PCOS are actually diagnosed, there are still lakhs of women who are not being diagnosed. Myth number 17, PCOS affects only women who are about 30 years of age. No, PCOS does not show age bias. It can affect any women after puberty. So the syndrome can easily affect adolescent girls and women of all ages. So let me discuss other interesting facts about PCOS, which we don't know. Eating disorders, as we know this, anorexia, binge eating disorders are also common among PCOS women. Women with PCOS have higher rates of anxiety and depression. If a woman is taking metformin and oral contraceptives, it is also more important to supplement her with B12 because the drugs which she is taking, that is the metformin and oral contraceptives, can interfere with the absorption of this vitamin B12. So we have to supplement her with vitamin B12. And women with PCOS are at higher risk of gestational diabetes, miscarriages, preterm deliveries, and stillbirth. And vitamin D, which is a hormone and a vitamin, has also shown to play an important role in insulin resistance and egg development. According to the studies, sleep disturbances are twice higher in women with PCOS when compared to the women without it. And if at all you are a breastfeeding mom with PCOS, it can also hamper the supply of your breast milk. So while women in general could start their lifestyle changes like concentrating on weight loss and diet to regulate their menstrual cycle, improve their sugar and cholesterol and blood pressure levels, and those who are trying to conceive should get their expert advice to improve their ovulation so that they can conceive naturally. PCOS may still be misunderstood syndrome, but trust us, there are a wide variety of treatment options available for it. And I thank Shield Healthcare for giving me this wonderful opportunity to discuss about the myths and facts on PCOS. Thank you.
Thank you, ma'am. Thank you very much for the wonderful presentation, ma'am. Again, ma'am, let me wait for 1 or 2 minutes for the participants to post their queries, ma'am, if any. If there is any queries, then I'll read it for you, ma'am.
Okay, sir.
One more myth is like if a adult girl or any college or school going girl, if she gets acne, immediately thinks that she's getting this PCOS.
First, when you take up a school girl, she will be very concerned about her appearance. So her acne will be a major problem, but she will not reveal the problem that she has got irregular periods. So if it is only a problem of acne, it could be due to a sensitive skin or something else which a dermatologist could deal with. But if at all she has a syndrome like acne, hirsutism, and irregular cycles and all that together, we can put her into the group of PCOS.
Yes, ma'am. Most of the times what happens is like they themselves counsel with themselves and they come for a treatment, ma'am. One friend will be saying one treatment, another friend will be saying some other treatment, and they keep on doing something and they won't meet the doctor.
The most interesting thing what you see is most of the PCOS patients will be referred from dermatologists. Okay. So they will be actually first they will be consulting for their acne, and to be true, she'll be having PCOS. So acne will not get cured until her PCOS is cured.
Okay, ma'am. Ma'am, another one fact is like when they are using these contraceptive pills,
Yes.
what type of pills they have to go, ma'am? Whether group of people should not use any particular type of contraceptives, or yes, ma'am.
Of course, we have indications and contraindications, because this is a very big topic, like hormonal pills. It has got its own risks. So it is usually prescribed accordingly. And accordingly means our aim. What do we aim at? If you are aiming at cycle regulation only, then that pills are different. And if you are aiming at hyperandrogenemia, where the patient has got all that hirsutism and all those factors, there the pills are going to be different. And when you take up a breastfeeding mother, you can't just like that give her oral contraceptive pills. So according to the patient, we have to tailor the treatment.
Okay, ma'am. Ma'am, coming to this ovarian drilling.
Yes.
So when should it be done, ma'am, and at what conditions it is not necessary?
If we have to be sure that it should not be done in unmarried women. So it has to be done when a woman is trying a longer time for conception and she has got resistant PCOS. A resistant PCOS means she will not ovulate in any form of protocol. You're trying all the drugs available for her, all that oral all stimulation you have tried on her, including injections and all that. If you have tried and she's not ovulating, then and she wants only natural conception, natural ovulation and all that, you can take up her. But usually ovarian drilling is avoided.
Ma'am, one more question, ma'am. What about the risk of metabolic disorders in these PCOS women, ma'am?
It depends upon their BMI, their sugar control, their cholesterol levels and all that. It will depend upon how severe the metabolic disorder is. So if at all she is very obese, morbidly obese and all that, the severity of the metabolic syndrome will be severe for her.
Ma'am, if a woman is having PCOS, you said that they won't be having this infertility, ma'am. So what are the risks when they come to their IVF or IUI treatment, ma'am? PCOS women with in IVF.
When you take up a case of IUI, and if you are giving her injections for ovarian stimulation, at times it can go for ovarian hyperstimulation, which we don't expect in an IUI cycle. So there is a difficulty in stimulating her. And even in an IVF cycle, for sure we have to go for an antagonist protocol, that is to control the hyperstimulation, and then we have to carefully track her follicles, and finally we have to look for the quality of the oocytes, which is very commonly not good. The PCO, when you take up the oocyte and look under the microscope, you find the quality is poor. So that is the only issue with the IUI and IVF.
Okay, ma'am. One more question is like, ma'am, when they come for this acne,
Yes.
So the chronic low-grade inflammation which causes this inflammation is causing this acne, ma'am. So whether any probiotics will be useful for them?
But if it is a case of PCOS, this acne will be caused by hyperandrogens, that is higher levels of testosterone. Yes, so it is not inflammation. As you say, the acne caused by inflammation is totally different. And this is due to the hormonal imbalance, that is high testosterone levels, which has to be managed with oral contraceptive pills, which will control your hirsutism.
Okay, ma'am. Ma'am, there is no other questions in the chat box, ma'am. Okay. Ma'am, if you allow us, I will take you to our Shield Connect webpage once.
Yeah, okay, sir. Yeah.
So, ma'am, this is our Shield Connect webpage, ma'am.
Yes, sir.
Yeah, ma'am. So, this is just a particular platform for organized by our Shield Healthcare, and it is all details which is associated with women's health is presented in this particular website, ma'am. So if you can see the blogs, you can see number of blogs written by experts, ma'am. So most of the doctors are writing the blogs, and it is placed in our web page, ma'am. Ma'am, if you are interested, or if you want, if you can share any blogs in anything, mainly as you are infertility specialist, so if you want to share any blogs in that area, you can just share with us, ma'am, and we will be posting it our Shield web page.
Yeah, sure, sir, sure.
And ma'am, the second one is the webinars, ma'am. So we have conducted more than 950 webinars in the last 3 years, last 2 years of time, ma'am, and all the webinars are available in our webpage, ma'am. You can find the details of upcoming and past webinars. All recorded versions is available in webpage, ma'am, and you can also find the details about the society webinars and other important informations which is present in the web page, ma'am. So I request you to go through our web page, and we also have more than 500 doctors who are supporting our web page, ma'am, through the all these are from webinars, blogs, and any scientific contents they are sharing. All will be, for example, you can click on any doctors, and you can see the webinars, whatever the doctors has done for us. All these webinars will be there in the web page, ma'am.
Yeah, okay, sir.
So I request you to go through your this web page and make use of it, ma'am. You can also share among with your communities, and if anyone is interested in sharing any webinars, or if they're any interested in sharing their scientific contents which they feel that it should be shared among the medical fraternity, then it will be very much useful for us for posting our web page, ma'am.
Yes, sir. I'll just communicate.
Yeah, ma'am. And we also have awareness page, ma'am, like PCOS awareness, ma'am. You can find the doctors talking about PCOS awareness in regional languages, ma'am.
Okay, okay.
So it will be available in Tamil, Telugu, Malayalam,
okay,
and all other regional languages, ma'am. All other, just it's a short video, ma'am. 2 to 3 minutes video will be there.
okay.
So, ma'am, I request you also to share some videos, and we'll be posting our web page, ma'am.
Sure, sir. I will do it for you.
Yeah, ma'am. Thank you, ma'am. Keep supporting us, ma'am. We are expecting many more webinars in the field of infertility with you, ma'am.
Sure, sir. Thank you, sir.
Thank you very much, ma'am. So, ma'am, if you allow us, then we can end the webinar for today.
Yes, sir.
Yeah. So thank you, audience. Thank you for your patient listening and active participation. Ma'am, thank you once again for being with us today and sharing the valuable information. And I also like to thank our team, Shiva, Srinivasan, and other division of Eva Care for organizing this webinar, ma'am. Thank you, ma'am. Thank you, one and all, ma'am.
Yeah.
Thank you, sir.
Thank you, ma'am. Have a nice evening. Thank you, Stalin, sir, and Shiv Kumar. Thank you.